came out to city officials late last week and explained to them that we have a three-judge panel order that we must respond to, and a Coleman order that we must respond to by this Friday. And in that plan, we have to provide detailed information of how we're going to address our medical and mental health population moving forward. Or last week, the secretary made a determination that DeWitt would be a good facility to possibly put a general population, medical and mental health population, to address our response to the Coleman Court and ultimately to the three-judge panel. So we met with city officials and explained that. That, of course, came on the heels of Mr. Kelso coming and explaining the advent of the Consolidated Care Center at the complex. The juvenile population is dwindling. These are departmental assets that are sitting unused. And again, with a finite amount of money, we had to look at our assets and maximize it. So we are converting the juvenile facility that has already been closed at Paso. We're including in that plan the conversion of Stark as a medical and mental health population.
Which is down in Chino?
Chino, California. And so really this is really again, the department trying to address a order to release 40,000 offenders and get construction and maximize our existing assets. And so that's what we explained to the city officials last week.
It wasn't on my radar screen at all until very recently, 6-8 weeks. And the negotiations about where to do this and how many beds, how much medical, how much mental health, those really were not at all resolved until just the last week or so, frankly. But having said that, I understand why they're shocked, because there were no meetings. I suppose the other thing to remember about it is, as Bob keeps saying, it's at the conceptual planning stage, where now is either part of the environmental study on NCRF, or I assume it would have ultimately its own environmental study. That's when CDCR will be going through that same type of a process. The healthcare facility here is going to be a new facility that's being designed with its therapeutic mission in mind. And it's going to be for the healthcare professionals who are already employed within CDCR. It's going to be clearly the flagship place to be. And so I'm pretty confident there's going to be a very strong demand for the jobs simply laterally transferred within CDCR. It's not a hospital, so we're going to be needing to use local hospital facilities to care for patients who have those higher medical needs. So we actually have, and we pay, of course, for those services. So we have a direct and very critical need for making sure that the local hospitals are not depleted. And there is a possibility of having an agreement about limiting our recruiting or hiring from those local facilities. Now, that's not something that we've reached an agreement about, but there's a way of us working with the local healthcare community so that we don't cause the sort of damage and harm that they're concerned about. Litigation usually interferes with getting to solutions, and that if a business lets its business be run by its lawyers in court, you're not going to have a viable business for very long. You need to work to find solutions to problems of this sort. Litigation would, I think, the only thing it's likely to do is probably delay what I think is likely to happen anyway. And that would delay bringing thousands of construction jobs to the area, and delay bringing hundreds of millions of dollars of investment to the area. And litigation can sometimes get out of control. One of the things I learned last year, you may recall, I sued the governor. In part, I was hoping that would lead to some fruitful negotiations. Well, it turned out that wasn't the reaction I got. The reaction I got was the state stiffened its resolve. That turned out to be not a good thing. So, litigation, I just don't think it leads you in the most productive direction, particularly when, as in this case, you really do have a state agency that is willing to have conversations that are more productive.
Best case for NCRF is an occupancy and,
With or without litigation.
best case.
Best case. Best case. So we know.
Best case NCRF is in the 2010-11 fiscal year. I think best case for the Consolidated Care Center is 13-14 right now. We're hoping to accelerate that. When I say best case, that's right now. The courts are going to continue to challenge CDCR to collapse these schedules and accelerate them. So best case is what we're looking at right now. We may have to best the best case. And then DeWitt, because it's the last project that we're looking at right now, it'll probably be 13-14 that it would be expected for occupancy.